Craig here for another episode of Make America Healthy Again with Dr. Bronwyn Fitz. Hey, Bronwyn.
Hey, Craig, how are you?
Pretty good. We're going to talk today about the pre-pregnancy medical consult. I guess you're looking for patients, women, to come in to see you before, or, in their pregnancy planning. You sent me a blog with 7 interesting points on this from a functional medicine integrative medical approach. And first, of course, is nutrition. Can you talk a little bit about the nutritional and supplement components as far as what women should be thinking about as far as having a healthy pregnancy?
Yeah. Well, so as an OBGYN, we always encourage women to come in before pregnancy to get a hold of any health issues that might be going on, or acute or chronic problems, and certainly to get screened for things like diabetes and infections and things like that. One of the things, as an integrative provider and a functional medicine doctor, I have real expertise in is nutrition. And so I really dive deep with that. A lot of women are really interested in kind of cleaning up their diet. And what I do is a really extensive look at what they're eating. We do a 3-day food diary, and I really get a good look at, the sources of their food and the quality. We talk a lot about, so some women are, have a great diet, and other women, need to sort of make some changes. And so we look at, where they're getting their proteins from, their vegetables and their fats and their carbs. And we look at the ratios of all these things, because most people in, sort of a typical American diet aren't getting enough vegetables and are eating a lot of processed foods. And so we really talk about the importance of getting high quality protein. And when I say that, I mean eating organic, grass-fed, meat and dairy, egg products, wild caught fish. The nutritional component of those proteins is so much greater than conventionally raised, beef and chicken and turkey and all those things. Not to mention they're free of, the pesticides and the toxins that come when, that phrase, you are what you eat. There's also, you are what you ate. And so, it's sort of a tongue twister, but, conventionally raised animals are given feed grain that is full of, pesticides and things like that. And those animals store those pesticides in their bodies, and then we consume them. So, eating organic, whether it's your vegetables or your protein, it's very, very important. And so, we talk a lot about that. And then cutting out processed foods, which is, full of the, wrong kinds of oils, and all kinds of other additives and chemicals, food coloring, and things that are just quite harmful.
Sure. And what about supplementation?
Yeah, so I recommend everyone get started on a prenatal vitamin before pregnancy. Those first few weeks of pregnancy, before you even realize you've missed your period and you're pregnant yet, is those are really crucial in the developing fetus. So I like a prenatal vitamin that has folate in it as opposed to folic acid. There's a lot of people do fine with folic acid. It's not the active component. It's not the active ingredient we need. What our body needs is folate. And your body has to convert folic acid into folate. And some people convert folic acid just fine, but there's a certain percentage of people who have gene mutations in this gene MTHFR, which they can't convert folic acid. And in fact, folic acid then becomes almost a folate receptor blocker in that sense. So not only are they not able to convert the folic acid, they're blocking the receptors, and nor can they absorb the folate from their diet. So for a certain percentage of people, folic acid is actually quite harmful. A lot of over-the-counter prenatal vitamins, in fact, a lot of our foods are supplemented with folic acid. And it came about because we realized that it was going to decrease certain birth defects, neural tube defects, and it has, and it's a good thing. But what I feel is that we now know there's a certain percentage of the population who that's harmful for. And so why not supplement with folate instead of folic acid? There's really no reason why we shouldn't. So luckily, there are a lot of really great prenatal vitamins on the market, and I always steer my patients towards one of those that has folate.
You also you talked a little bit before about you are what you eat. We've heard that oftentimes um, when it comes to eating. But I mean, also you are what you absorb, and that goes into the sort of gut microbiome, which is something else that you listed on the list here, which is the bacterial balance in the gut. Can you talk a little bit about that?
Yeah, yeah. So, there's a few tests that we'll often do, not always, but if you're interested, and certainly if I see any signs that there might be a concern that we should look into these things, we look at your nutritional absorption. So, well, there's two main tests we can do. If we were looking at the stool tests, we can really see what you're absorbing. Are you spilling proteins? Are you spilling fats? If you're spilling fats, that means you might not be getting your fat-soluble vitamins, right? Vitamin D and things like that. But we also get a sense of your the gut microbiome. So for those of you who don't know, the microbiome refers to sort of the bacterial colonies that we have in our body. We have trillions of bacteria all throughout our body. And it turns out that the bacteria that populate our colon is very, very important for absorption and for metabolism and for all kinds of things. There's studies coming out linking it to, depression and weight gain, weight loss, all kinds of things. And we also know that there's, when you have the wrong bacteria in your colon or in other places in your body, you're susceptible to infections. And so just tying it into women's health, we look at often the bacterial population in the genital tract. And so women can have something called bacterial vaginosis. And so that's also something we screen for to make sure that, because that is associated with adverse pregnancy outcomes. So we not only do the screening of the genital tract and make sure that there's no infections there, we look at the GI tract as well. And it only makes sense because, the gut microbiome population that we have in our GI tract, we will pass on to our infants that we deliver. So it's, pre-pregnancy is the perfect time to really evaluate the health of the GI microbiome. And so we can do that. And I do that from history. How are you feeling, GI wise, but then also we do the stool test and we actually look at it. And then tying it back to the nutritional status, we also have these really fantastic ways of evaluating your nutritional status as far as your micronutrients, all your vitamins, as well as things like your antioxidant capacity. We look at, in the same test, we'll look at heavy metals. A lot of people have elevated mercury. They don't even know it. And most of us get that exposure from eating fish. So again, in pregnancy, you have to be a little bit careful about fish because of the mercury. So I want you to eat, wild caught fish, but really you need to steer clear of tuna and things like that. The predator fish that are more likely to have the mercury. But so we look at that before you're pregnant, before it's a problem. And if we need to help you, decrease that mercury level, we can do that before the pregnancy.
Now, everything you're saying about passing through in pregnancy, also, post-pregnancy and after birth, all these things impact the milk, right? I mean, in the nursing capacity as well. I mean, all these things change and improve, or risk not improving the nutritional profile of the mother's milk. Isn't that true?
Oh yeah, absolutely. And your caloric demand and everything else goes up as you're breastfeeding. But the breast milk is, I always encourage women to breastfeed if they can. I don't want to, make anyone feel badly or feel guilty if they can't breastfeed, because I certainly know many women are unable to breastfeed. But breastfeeding is the best for the newborn infant. And again, what you're eating and drinking is basically you're directly feeding your infant at that point with the breast milk. So it's so crucial.
Great. Well, this has been great information. We're going to post this whole list here as a blog together with the video because you have some really great pointers here. And also, I will say that they're probably good for the dad-to-be as well to follow, except for the prenatal vitamin part.
Yeah, absolutely. And when partners work together in terms of making these sometimes difficult lifestyle changes, it's great when partners are working together, making dietary changes together, exercising, and making these lifestyle changes together. They're much more likely to succeed for the long term. So I encourage people to work on it as a family.
Great. Thanks so much. We'll talk again
Thank,
soon.
thanks, Craig. Take care.
Have a good day. Bye.
You too.